Hello and welcome to the Diagnostics of Cardiac Failure in the module Cardiology. By the end of this session, you should be able to define cardiac failure, outline the causes and pathophysiology of cardiac failure, classify cardiac failure, describe the clinical presentations of cardiac failure, and also discuss the diagnostics of cardiac failure. Let's get started. So, what is cardiac failure, or in other terms, cardiac insufficiency? Cardiac failure happens when the heart is unable to supply enough food to meet the body's demand. The WHO defines cardiac failure according to the degree of reduced physical capacity due to ventricular dysfunction. The two big categories of cardiac failure are systolic heart failure, which is the failure of the ventricles to pump enough blood during systole, and the second type of heart failure is diastolic failure, whereby there's not enough blood that fills in the ventricles during diastole. The other classification is based on the cardiac output. This too corresponds to the previous type we had looked at. According to this classification, one can differentiate between low output cardiac failure and high output cardiac failure. The first form constitutes forward heart failure with insufficient cardiac output, whereas high output failure is when cardiac output is increased due to a peripheral lack of oxygen supply. Now, let's classify heart failure according to the affected area. Depending on which chambers of the heart are affected, cardiac failure may be referred to left ventricular cardiac failure, right ventricular cardiac failure, or bilateral ventricular cardiac failure, also known as congestive cardiac failure. Isolated right ventricular cardiac failure, in comparison, is rare and frequently occurs as a result of left ventricular cardiac failure causing a backflow of blood into the right chamber of the heart, which results in right ventricular cardiac failure. Patients with cardiac failure are broadly characterized into one of four groups based on whether they present with or without hypoperfusion, with or without fluid congestion. Classifying patients into one of these four groups is clinically useful as it determines the therapeutic approach. There are different models of classifying cardiac failure according to various aspects. A very broad classification is the division into compensated and decompensated cardiac failure, or the classification into acute or chronic cardiac failure states. This is the NYHA classification. NYHA stands for New York Heart Association. This well-known model divides cardiac failure into four classes according to their clinical severity. Class 1 being no symptoms and normal physical capacity. Class 2, symptoms may appear only during increased physical activity. Class 3, symptoms already appear during light physical activity. And finally, Class 4, where symptoms appear at rest. There are several causes of cardiac failure. The most common cause is hypertension in more than 50% of cases, which may result in coronary heart disease, myocardial ischemia or infarction, and other more uncommon causes are atrial fibrillation, cardiomyopathy, valvular heart diseases, high output cardiac failure, or pericardial diseases. This is the Frank-Starling's curve, which is based on its law, and the law states that the stroke volume of the heart increases in response to an increase in the volume of blood in the ventricles before contraction, which is the end diastolic volume, when all other factors remain constant. The functional importance of Frank-Starling mechanism lies mainly in adapting left to right ventricular output. During upright physical exercise, an increase in end diastolic volume due to the action of the peripheral muscle pump and increased venous tone can assist in enhancing stroke volume. Now let's take a look at the clinical presentation, which includes the symptoms and signs put together. The symptoms of cardiac failure are variable depending on the severity of the insufficiency. Among them is dyspnea, on exertion, or even at rest at a more advanced stage. You may also have wheezing, known as cardiac asthma, and orthopnea, reduced effort tolerance, symmetrical lower limb swelling, especially on the ankles, on the tibia, and on top of the foot. There's also nocturia due to nocturnal voiding of edema. Cerebral symptoms such as confusion and fear are caused by the diminished blood flow to the brain. The physical examination can yield these findings, which include edematous appearance, raised jugular venous pressure, displaced apex beat, lung crepitations, symmetrical lower limbs edema, and proteinuria. Diagnostic markers of cardiac failure are BNP and NT-proBNP in particular, which are released by cardiomyocytes during physical exertion. Other laboratory tests include cardiac enzyme to assess myocardial damage, such as CK, CKMB, and troponin, blood glucose levels, liver and kidney function tests, serum cholesterol levels, thyroid function tests, and full blood count. Aside from laboratory findings, ECG and echocardiography are suitable for diagnosing cardiac insufficiency. Typical changes in ECG are cardiac arrhythmias or evidence of ventricular hypertrophy as depicted in this ECG. In terms of imaging, a chest radiograph is the basic imaging test that can be carried out to further investigate this condition. This is a chest X-ray showing cardiomegaly, which is one of the evidence of cardiac failure due to cardiac remodeling. Cardiac echocardiography is particularly suitable for diagnosing cardiac dysfunctions. It will show ventricular hypertrophy, valvular heart disorders, or changes in cardiac wall motion and ventricular dilatations. Other important pathologies that it can exclude also include pericardial effusions and cardiac tamponade. Complications from cardiac failure are to be taken seriously as they frequently result in death. Complications include arrhythmias, which can be malignant like atrial fibrillation, ventricular arrhythmias, and bradyarrhythmias. Thromboembolism complications, which are stroke, pulmonary embolism, and deep vein thrombosis, gastrointestinal complications such as hepatic congestion and dysfunction, and malabsorption. Amongst the respiratory complications are pulmonary congestion, respiratory muscle weakness, and pulmonary hypertension. So let's summarize. Cardiac failure develops when the heart fails to pump blood to fulfill the requirements of the metabolizing tissues. The common classification used is the New York Heart Association classification, which is a system that categorizes cardiac failure on a scale of 1 to 4. The causes of cardiac failure include long-standing hypertension, atrial fibrillation, cardiomyopathy, valvular heart diseases, high output cardiac failure, and pericardial diseases. The diagnosis of cardiac failure begins with identifying clinical features and carrying out appropriate investigations to diagnose and classify the severity of the disease. Echocardiogram is a useful tool to grade the severity of cardiac failure and to probably also look out for the underlying cause. Finally, management of cardiac failure will include treating and having a good control of the underlying cause and preventing further progression of the disease. We will be discussing the therapeutics of cardiac failure in the next topic. We have come to the end of this topic. Thank you.